Let me ask you a question. Have you ever felt uncomfortable being close with your partner? When I say being close with your partner, you understand, right? Or have you ever felt like there was something different about your breath, your smell, or the changes in your body generally during pregnancy, and this just made you distant from your partner? If you're facing any of this, or if you're a man and your wife, your partner is facing any of this, stick with me, okay? I'm going to be talking about something that a lot of people are afraid to talk about. That's hygiene in pregnancy, and even generally it's difficult to tell somebody, I think your breath smells so, baby, that smell so, it really doesn't make sense, right? And in as much as pregnancy is a beautiful thing, it comes with a lot of changes. There's hormonal changes, you begin to sweat a lot, the vaginal discharge increases, and fatigue becomes real. Things like taking a shower or even brushing your teeth becomes a chore. And so, because of all of this, women unintentionally neglect their personal hygiene, and now over time it affects their self-confidence, it affects their health, and it affects their intimacy with their partner. So sometimes when Ma is saying I'm tired, it's not because she's actually tired. It's probably because she feels like I don't think I'm that clean to mingle with you at this moment. Okay, so in this video we'll be talking about the hygienic practices that are neglected during pregnancy, and I'll also be giving some tips on how we can improve on our hygiene. And most importantly, I would also be talking about how we as caregivers and partners can help pregnant women to maintain their hygiene in pregnancy. Because if we're being realistic, with the baby bump, it's hard to get in there and clean, right? So they'll definitely need some help. Okay, so you stick with me to the end, and I hope this video helps you. Okay, personal hygiene is not about beauty. Far from it. Personal hygiene is how you keep yourself clean, comfortable, and healthy, preventing your skin from infection. So, some of the aspects of personal hygiene are your bathing, your skincare. When I say skincare, I don't mean all the fancy stuff, okay? I mean technically not fancy, but you don't have to go over and above to have a skincare routine. Okay, just bathing properly, using soap and a sponge, and also concentrating on the places that hold smells, like your armpits, the parts of your ear, your genitals, below your breast. These are places that hold a lot of sweat and odor. Okay, so these are some of the aspects of personal hygiene. And there's also oral care, how often you brush your teeth, the things you eat after you brush your teeth, when you brush your teeth. Then there's also what you wear, okay? Your underwear. Some people repeat underwears. And some people repeat clothes. It's not a bad thing to repeat your clothes. But when you're all sweaty and the clothes are dirty and you take a bath and you put them on again, you're just basically tossing away all the hard work that you've done, because there's still going to be smell coming from you from the clothes you wore. Now, specific in pregnancy, what makes hygiene in pregnancy more difficult? During pregnancy, most women notice that their vaginal discharge changes. Okay, for some women it becomes more, and for you to know that your vaginal discharge is okay or is something you should worry about, take note of these three things. Okay, the vaginal discharge should not have any smell. Okay, it should be odorless. If it's having a smell, the next thing is it should not have any color, or maybe a very light creamy color. It's okay in pregnancy. But if you notice that your vaginal discharge is yellowish, is brownish, sister, head to the hospital. And the last thing is, you should not be itchy. Okay, if you have these three things, then there is something off about your vaginal discharge and you want to get that checked. So back to our hygiene, some of the common things that we women do that affect our hygiene, sorry, in our genital areas is that some women don't wash their genitals daily. Some people just take a bath and they don't go down there. Some, you use your hands inside your vagina. No, no, we don't do this. You don't have to send your hand. It's called douching. You don't have to send your hand inside your vagina. The vagina typically cleans itself, so you don't have to send your hand inside. The other thing is using strong soaps or antiseptics to clean our vagina. All these vagina wash, sweet in the middle, which one, the names are too many. Dear sisters, you don't have to use these things, okay? Clean water is enough to clean your vagina. You don't have to use all the uh, chemicals and all of those stuff. Trust me, you're doing yourself more harm than good. Another common mistake we make is wearing very tight underwear or synthetic underwear. And I just want to use this opportunity to also talk about pant liners. Pant liners are not meant for daily use. Yes, you heard that right. Your pant liners are meant to be used just about few days after your menses to hold off any residue from your menstrual flow. It's not something that you wear every day till you see your period. It's a very unhealthy practice, okay? If you have your clean cotton pants, you're good to go. You don't have to wear your pant liners every day, okay? And avoid synthetic underwear. Concerning oral hygiene, I'm talking about our mouth and our teeth, okay? Because of the morning sickness, it's hard to brush sometimes, okay? But then, if you don't brush, you have the potential of bleeding gums, bad breath, and so try to use a soft toothbrush to brush. Brush your mouth mornings and evenings. It's hard, but we can do it, okay? Also, if you vomit, rinse your mouth with clean water. And if you're having any bleeding gums or mouth thrush, you should see your healthcare provider. Now, with sweating and body odor, try to change your clothes as soon as you sweat, because sweating increases during pregnancy because of the hormones and all of that. So don't keep your clothes on for so long. Sometimes you're out, you're in the market, that's understandable. You can always carry a towel along to wipe yourself. And then when you're taking a shower, try to concentrate or pay more attention to the areas that have folds, okay? And like I mentioned before, the back of your ears, your armpit, your thigh, your under breast, and avoid using the same clothes or the same underwear that you'd worn before, because these are the little things that would make your skin to have some odor even if you're taking a shower. Because of these neglected hygienic practices, some women feel neglected, they feel embarrassed, and they don't know how to go about it. And the partners, on the other hand, some feel confused, they're also afraid to speak up, they don't know how to bring this up to their partners, okay? And that's where we are headed to next. As partners, how do we help? What do we do differently to help our partners? The first thing is be kind. Pregnancy on its own is it's difficult, so be kind with your words, be kind with your actions, and then be supportive. You can be like, oh baby, I know you don't feel like brushing, but I could help you. I could help you brush. Or when you're taking a shower, you could help her scrub. You could help her wash down there. Yes, you can do it. What's there to say, okay? You can help your partner do laundry. Sometimes they are putting on the same clothes because all the other ones are dirty, and just doing little things in the house that makes her comfortable and less fatigued, in such a way that she also has more time to take care of her personal hygiene. If you use all of these steps, you realize that okay, slowly your partner is becoming more confident. You're also able to open up to each other. If there's something wrong, you'd be like, oh baby, I feel like that bread, it did like say you don't dey come back small small. Or you can be like, baby, you wash today, I feel help you. I mean, just simple things like that. It doesn't have to be that hard, okay? So in summary, to help with your hygiene, especially in pregnancy, brush twice a day. You can use a soft toothbrush. Always wash your genitals. Take a bath daily. It doesn't have to be twice a day, but at least let the day not pass without you taking a shower, please. Okay, and don't wear tight clothing. Don't wear tight underwear. Put on clean cotton pants. When you're bathing, do not douche. Do not send your hand in there. Avoid using strong antiseptics in your vagina. Okay, so I hope, and remember to drink a lot of water. I hope you were able to get a lesson or two from this video, and I hope it's going to help you and your partner bond better during pregnancy. If this video helped you, please share to a mother or a mom to be, a sister, and anyone. Okay, thank you so much for watching. Please like, share, and subscribe. Bye.